I have a nightmare that I walk out into the corridor and there's dead bodies in body bags on trolleys.
Sara dreads work and wants to leave. She often treats patients in corridors. It is, she says, undignified and unsafe.
A relative said to me, my mum was really struggling to breathe, and I went over to her and she was almost in a respiratory arrest, so her oxygen levels were so low that she almost needed resuscitating because the oxygen at the bottom of her trolley had run out.
With hospitals close to capacity, cramped corridors are filling up. This isn't makeshift medical care. It's now the norm. Speaking anonymously, 2 nurses have told Sky News of their harrowing experiences.
We don't just corridor care in the winter, it's an all-year-round problem. We've been at capacity in the hospital for so long, we just invent new spaces. I have come to the very sad conclusion this week that I don't think I can continue working in the NHS or as a nurse. It breaks my soul. I love what I do.
For patients too, the reality is dire. Rowena's 76 and spent 2 days being treated on a chair in A&E. Not once, but twice.
I think everyone's totally demoralised. I think it's survival. I think the staff are demoralised. I think I'm petrified now of having to go into A&E. I would say at the moment, healthcare as we know it or knew it doesn't exist.
NHS England says this is not the standard of care it aspires to. At Queen's Hospital in Essex, they're apologising and advising patients to lobby their MP, who here happens to be the Health Secretary.
We've got a really poor layout, it's really cramped, we've got no waiting room in the majors area, and when we see 30 or 40 patients an hour, as we do at the peak of demand, people just get put everywhere. They're in 3 or 4 different corridors waiting to be seen and treated.
Social care shortages delay patient discharges, and although flu's now peaked, demands and pressures on hospitals and staff are still high. Laura Bundock, Sky News.